We'll talk about the next abbreviation, so to say, that we'll be looking at. And the next one we're looking at is what is known as the alpha-fetoprotein. Okay, they call that the AFP. Okay, we'll talk about what it is and why we study this in chemical pathology. So for the alpha-fetoprotein is as follows. You can see they even do a test for it to measure the levels. So let's look at this. It's a glycoprotein and it plays a very important role as the baby is developing. Do you understand? So it's even a biomarker. You can use it to now measure if a baby has an issue or not. You know, so it's produced mainly by the fetal liver as the baby is developing in the mother, also the yolk sac and the gastrointestinal tract. Okay, so it's a glycoprotein and its molecular weight is about 70 kDa. It functions like albumin in fetus, okay, binding and transporting molecules. So adult levels is very low because you are no longer in your mother's womb. That's once they give birth to you. You no longer have a yolk sac, you no longer have a fetal liver. So the levels are normally to be low. So when you see the levels of this thing being high in a child that is already born, being high in an adult, it indicates that there's an issue. And this issue in the body is trying to turn your body to be as though you are still in your mother's womb. Okay? So this is how the test could be like. And they measure the levels from the blood. Because any of these things that is so much in your body, it gets into the blood. So it's widely used in diagnosis, monitoring, and screening. It's measured in the maternal serum as part of the triple or quad screen test. When the levels are high, it indicates that there's all those abdominal wall defects, spinal bifida, all those neural tube defects. Okay? Spinal bifida and anencephaly. Then sometimes if the levels are abnormally high, probably in a child that is still in the mother, then you know that you are expecting all these chromosomal abnormalities like Down syndrome, trisomy 18. It's also a marker of cancer. So cancers of the liver makes the levels high, abnormally high. Okay, and also germ cell tumors. So other liver conditions like hepatitis, I can measure the levels of alpha-fetoproteins to diagnose hepatitis. Also liver cirrhosis, I can measure the levels of what? Alpha-fetoproteins to diagnose, you know, liver cirrhosis. Okay, so normal ranges should be actually lower than 10 nanograms per mils. Okay, you understand. So I think basically that's what we got. Okay, okay, that's what we got for alpha-fetoprotein.